Hey everybody, Dr. Derek Gatta, one of the co-founders here at RiseWell. Excited to have everyone here today where we've got an engaging discussion all the way from Dubai with Dr. Laura Maanon in optimizing children's oral health. So Doc, if you're out there, I'm going to be inviting you on here and let me get that going. Technology is going to cooperate and get our live feed from Dubai going. Hey, Dr. Laura, good morning.
Good morning.
How are you?
Well, good night here.
That's true. Yeah, this is a real treat for us. You're our first international guest all the way from Dubai, and we're excited to have you. And I forgot with the time change, it is nighttime over there. So thank you for joining us.
Yes, thank you so much for having me. Really, really happy to be part of this life.
Hey, wonderful. So before we get started, I just want to read your bio and kind of give our viewers and listeners a little bit more information about you. So Dr. Laura is an airway-focused functional dentist, graduated from the Complutense University of Madrid in 2013. Committed to delivering top-notch dental care, she works to pursue continuing dental education. Driven by a passion for excellence, she has completed courses in dental sleep medicine, safe amalgam removal, biomimetic, minimally invasive dentistry, and cosmetic dentistry. She firmly believes in the mouth-body connection. She collaborates with healthcare providers to address the root cause of patients' health conditions. She's based in Dubai in the United Arab Emirates, and you can learn more on her Instagram channel. So Doc, tell us about your journey to dentistry and a little bit about your background and how you ended up all the way in Dubai.
Well, the way I ended up in dentistry was more or less by chance. I always knew that I wanted to be in healthcare. I really liked everything about how the body works. Even biology was always one of my favorite subjects. And I have a cousin, she's a doctor, and I was like, I don't know if I will do medicine, if I will do dentistry. And she was like, do dentistry. If you want to have a life, do dentistry. So yeah, I chose dentistry because of that. But I always kind of liked to know a bit more into why things happen, right? So that's what led me slowly to functional dentistry and to biological dentistry. They wanted to know why these patients keep getting cavities, wanting to break the cycle of having a patient come to my clinic with a lot of cavities, me fixing all the cavities, and then having the patient come back 6 months later and having again more cavities. And it's frustrating for me, frustrating for the patient. So little by little, I started to try and find out the root cause of a lot of the problems in the mouth, and little by little started to work with other healthcare professionals to help me help my patients.
Oh, that's great. Thank you for sharing that. And it's funny. So my father, one of his good friends, was a gastroenterologist physician. And I was always interested in healthcare, and he recommended, don't do what I'm doing, check out dentistry. And I had a great family dentist as a kid, and I really connected with what he was doing and really enjoyed the science and the art of what he was doing for his patients. And it kind of resonated with me as well. I also saw that you spent some time in Europe and Ireland. And
yes.
How was that experience for you?
Very good. I mean, in Ireland is where I think I expanded a little bit the way of doing things, because I moved to Ireland when I was only practicing for 2 years. So I was like a newbie. And I moved there. I was there for 5 years. And I got to practice in a really nice clinic in Ireland. And the owner was very open to, she wanted me to do a lot of courses and wanted me to learn things. And it was really great for me, for my experience, because the clinic where I was working when I first graduated was the complete opposite. The owner was like, you learn by working. You cannot do any courses. If you take days off, you're out of the clinic.
Oh,
I'm like, okay. He was very traditional. He didn't believe in ceramic restoration. So very old style, very much different from what I do nowadays. But Ireland was really, really great. I actually is where I grew my following. I had so many amazing patients. At the beginning, it was really difficult for me, especially with the accent. But then it was great. I mean, the people there are so open and warm, and it was a really great experience. But then, the sun is not present most of the days.
Yeah.
So I wanted to move somewhere a bit more sunny and warmer, and we moved to probably the sunniest place on earth.
But no, that's great. It sounds like you've had a wide variety of experiences, and it really just kind of adds to who you are as a person. And thank you for sharing that. And previously, you had mentioned a couple topics and terms that I'm not sure all of our audience members really are too familiar with. So maybe if you want to elaborate more, and maybe the type of dentist you consider yourself, was it like biological, functional, and kind of what that means, and what kind of like your treatment philosophy is with those terms?
Yes. So basically, a biological dentist means that we care about what kind of products we use in the mouth of our patients. So we try to avoid anything harmful, any chemicals in general, and try to look for the most greener, cleaner options. Of course, we need to do a lot of research on this, because not all the cleaner and greener options work as well as the traditional treatments and materials. So, but we always try to use non-chemical. For example, I'm completely fluoride free in my practice. I don't do any like fluoride varnishes or fluoride toothpaste, anything like that. Amalgam and mercury free, and we in the clinic are the only ones in Dubai to do the safe amalgam removal protocols. So basically it means that we remove your amalgam fillings in a way that is not going to harm you. And then, of course, in terms of the functional approach of dentistry, it means that we don't see the patient as a mouth, as we were told in college. Is like, you have a mouth and that's it. You do nothing. Everything is disconnected from the mouth. We, as a functional dentist, what I do is I check and see the connection between the mouth and the rest of the organs. In the mouth, we have loads of blood vessels, nerves, connections. Each tooth has its own artery and vein and nerves. So anything that happens to a tooth, it's going to affect the rest of the body. I always remember a patient I had in Ireland. He came because he was in pain, right? So he came, and the moment I saw him in the waiting room, I was like, you need to go to the ER. He had a big swelling. He was sweaty, pale, shivering. It was very obvious that he was very sick. So I sent him to the ER, and in fact, he had a sepsis, and he was in IV antibiotics for a couple of weeks. So it tells you that even just the dental abscess can cause serious problems in the body. It can cause endocarditis. Even if it's not a big abscess, even if it's just, gum disease, chronic gum disease, or an infected root canal that has been there for years, it can cause general inflammation in the body that can, even sometimes affect the immune system and cause some triggering autoimmune diseases and things like that. So that's my approach. I work I'm very grateful that I have a functional medicine doctor in the clinic. So we work together to try to help our patients the best we can.
Yeah, again, thank you for sharing all that. I was checking, your website. You do have a huge team of not only dentists, but physicians, and it seems like a really wonderful operation and co-working group you have out there.
Yeah, it's amazing. We have all the specialties, and all of my colleagues are really committed to, keeping up to date and learning. And we have a root canal specialist that is amazing. He's doing very innovative treatments, trying to regenerate the vascularization of adult teeth, treatments that are more usually done in kids, he's doing in adults. So to try and do more biologically treating the root canal treatments.
No, that sounds wonderful and very conservative. I really like that style of dentistry. And you had said things previously that kind of resonate with me as well. I mean, I'm very fortunate and thankful for my dental school education, but in America, it's very conservative. They don't talk about hydroxyapatite much, maybe 30 minutes in oral histology first year looking under the microscope, but beyond that really wasn't even considered as a therapeutic use. So I think slowly, the research is getting out there and educating people later on, but it's just kind of a slow moving entity, academia, but that's just kind of the nature of the beast. Tell me, what kind of procedures do you do in your clinic? What do you like to do as a functional dentist, and what do you enjoy?
I really enjoy finding out what is happening to someone. So a patient that comes, with a lot of cavities, or a patient that comes saying that I'm doing my best, I'm doing everything right, and I have, bad breath or gum disease, or even patients that come from my colleague, the functional medicine doctor, that have a lot of fatigue or that have autoimmune disorders, hormonal imbalances, and trying to find doing a little bit of detective work and trying to find what is happening. And then, of course, another one of my big passions is prevention, especially in children. I really love trying to avoid problems in the future, especially related to sleep disorders like sleep apnea, mouth breathing. All of this is something that really I'm really passionate about, because you can change someone's life for the best completely if you catch things early and change a few little habits. A child can be breathing perfectly and avoid having, sleep apnea as an adult. So those are the things that I really enjoy the most. I, of course, really like doing cosmetic dentistry as well, because, it's really rewarding as well, seeing a nice smile. But definitely things that relate to health are the ones that really I enjoy the most.
No, that's a great variety of procedures. And also, so I don't treat children. I'm a prosthodontist, and I just treat mainly older adults. So treating children is different for me. But when you see children looking at sleep apnea or sleep disorders, I mean, do you notice tongue tie or any other conditions that young children or parents might be missing? And how do you have that conversation with parents?
So I assess all of my patients for breathing disorders, or I check all my patients to see if they have a tongue tie. I check all my patients breathing, adults or kids, and I check also how they move their tongue, how is the tone of the lips or the tongue, and things like that. What I find that normally leads more to mouth breathing or sleep apnea is big adenoids and big tonsils. We don't know what comes first, if it's maybe that they have a tongue tie and then they mouth breathe, and then of course these adenoids get swollen, or if it's, that the adenoids and tonsils are going to get big anyway. But definitely tongue ties play a role as well, because of course if a tongue is not able to move and go in the right place, it's going to be low in the mouth, and it's going to make the child more prone to breathing through their mouth. So it's something definitely that I see a lot, and a lot more. I don't know if it's because I'm more trained now and I look for them, but definitely I'm seeing more and more tongue ties in children and in adults as well, that they were missed.
No, that's great. The patients are getting the intervention and treatment they need, because if that's left untreated, that can really affect speech development and sleeping. So that's great that you're catching that early. One thing that's interesting too, I'm not sure if patients realize that, but as humans, we're really designed to be breathing through our nose. And so one thing I talk to my older patients about, that it's very common for older patients with their medications to have dry mouth and xerostomia. And saliva is a very strong protective factor against cavities. So when you have dry mouth, it leads to root caries in the older population. And so I just try and remind them that they should be breathing through their nose. That way their tongue is up against their palate. You don't unnecessarily dry out the mouth. So I really talk to them about nose breathing. And I know it's relative to children and growing populations as well, just for proper facial development, to be having your mouth closed and breathe through your nose as well.
Yeah, 100%. I see, especially the kids that come with big cavities or a lot of cavities. A lot of them are mouth breathers. This is one red flag, that every time that I see a child with a lot of cavities, I know that very likely they're breathing through the mouth. Because of course, diet plays a role, hygiene plays a role, But if you don't have saliva, as you said, if you don't have saliva to protect you against those cavities, it's very likely that you're going to get them. And if you're constantly breathing through the mouth, is of course one big risk factor for cavities.
Absolutely. And in terms of nutrition, do you talk to your patients about nutrition? I mean, it's so interesting that decay and caries is such a leading preventable disease in children. And, you know, when you go back all the way to the 1930s with the work by Weston Price and his book on nutrition, and just looking at indigenous populations versus populations that were eating the Western diet, I mean, a lot of what we treat just goes back to nutrition, and it's so preventable. Do you have a conversation with your patients and their parents regarding nutrition?
100%, especially with my kids, because I find with adults it's a little bit of a more difficult topic to talk about. They're not so open to change. I always tell them that in kids, especially, I always ask about the diet. And what I find is that nowadays the main problem is not so much the composition of the food, which as well, because everything has sugar nowadays, everything is acidic. But it's what I find is mainly two problems, which is the texture of the foods that they're having. Kids are having a predominantly soft diet nowadays. Everything comes in pouches, everything melts, everything is like easy to eat. And they are eating too frequently. There's this, I don't know, when I was a child, this snacking thing was not a thing. My mom never left the house with a bag full of packages to feed us, you know. It was like you had your 3 meals, maybe one snack in the afternoon, that's it. Nowadays it feels like kids need these snacks. I don't know in the US, but in Dubai is very popular. There's like these snack boxes that come with like 10 compartments for the kids, so that you can have like 10 different snacks for them. It's like, you know, we're in this cycle of snacking all the time, and usually not in so great snacks is like Cheerios and crackers and things like that are going to stick to their teeth, and we're not allowing the mouth to do its job of remineralizing the enamel. So this is something that I always tell my patients, that you need to allow time for remineralization. You cannot be sipping on coffee the whole morning. You cannot be eating, snacking all the time. You need to have proper full meals and then maybe a snack afterwards. And of course, you know, composition and trying to get healthy fats, protein, because what I find is that most kids are having really high simple carbohydrate diets, a lot of not with snacks with no nutritional value. So they're really surviving. They're not getting their optimal nutrition from the food.
Yeah, you make a lot of good points there. And I think, look, snacks and food is big business. I mean, companies want to sell snacks, and the more we eat, the more it helps them. So I get it. You know, I see it here, and I do talk to my patients a lot about nutrition too, because it is a preventable disease, and I hate to see my younger patients get exposed to decay and caries when a lot of it just goes back to basic nutrition. And you know, I talk to them about how a lot of our foods basically break down into 3 macromolecules. I mean, you got your fats, proteins, and carbohydrates. And if you're not eating fat or protein, pretty much everything else is reducing to some form of carbohydrate. And really making sure they understand that getting that residue off the teeth is critical to help prevent the demineralization process. Try and avoid sugary foods, acidic foods, and also foods like crackers. People don't think, oh, like it's not a candy, it's not sweet, so it's probably safe, right? Well, I mean, crackers, they're some of the biggest culprits. I'm not going to name any brand names, but those fermentable carbohydrates is just perfect fuel for bacteria to reduce them into the sugars that cause the decay causing process.
And they stay on the teeth for so long, right? They're so sticky onto the teeth of the
it's crazy.
Molars.
It's crazy. And so I tell patients, look, I mean, once the pH drops below 5.5 in your mouth, that's like the cavity causing demineralization process begins. And it's important to just get that residue off the teeth. A lot of our products are slightly basic, so it elevates the pH into a non-cavity forming zone. So it's really helpful for people, and really just try and empower them to just stop the decay causing process.
Yeah, I think it's what you say about empowering the patients. It's something that I really love because sometimes they think it's like there's nothing I can do. Just come into the dentist and get my cavities done, and that's it. No, there's a lot you can do. I mean, you can do a lot.
Yeah.
And maybe you will never need us. Maybe you will only need us for just a little cleaning.
Yeah.
If you have the diet right, the hygiene right, using the right products, breathing through your nose, and of course, sometimes there's other things that can lead to cavities like vitamin deficiencies, or I have some patients, for example, that have digestive issues, and they have maybe IBS or Crohn's disease, and they are not absorbing all these nutrients and minerals properly. So sometimes we need to work on that as well. But there's so much patients can do, and that's what really makes me happy to be able to get them the power, and they're able to be the owners of their own journey.
Yeah, I love that. It's good to just empower people to stop the preventable disease process. Also, do you have any tips for parents looking to help make positive impacts in the oral health of their children, and why maybe they should see a functional dentist versus a conventional dentist? Any thoughts on that?
So I think a functional dentist, it's good in the way that it will help you to understand what is happening. It will help you to find the root cause of the problem instead of just fixing the cavities and that's it. Also because for example, in a clinic like mine, we are really conservative, and then we try to use lasers. We try to use always ozone to disinfect the cavities instead of chemicals. So it's going to be safer for the child and usually less traumatic, because we can avoid a lot of the times using anesthetic, and the process is easier for them. And then in terms of tips for the kids, I think my number one tip would be to observe your child. If your child is constantly with the mouth open, is breathing all the time through the mouth, if your child is snoring at night. I had a patient today that the mom told me that they are constantly snoring since they were a child, since he was like 1 week old, and she thought that this was normal because the husband snores. So she was like, yeah, I thought it was fine, it was normal. And I saw the patient today. He's 7, and he already has I can see already the development of the jaws are not going how they should be. He has a lot of lack of spacing. He has a lot of ADHD symptoms. He's not able to focus. He's constantly, these are all symptoms that come a lot of the times from children that don't sleep well at night. So I think this is something that for me is super important, the breathing, because if they don't sleep well, if they don't breathe well, they're not going to sleep well, and everything else is going to go out of whack. Cavities are going to happen. They're going to be cranky and moody and not behave well in school. They're going to not want to eat healthy foods, because I don't know about you, but when I have a bad night's sleep, I want to eat bad food.
Yeah.
It's like you don't want to move, you don't want to go to the gym. So it's the same for kids. So I think this is my number one tip. And then in terms of diet, to reduce the snacking, because we all know that we don't need to eat sugar and things like that. But the snacking, I think, is very important.
Yeah, it's incredible how much sugar is in basically everything we eat, and these companies just they know the customers will buy it, and it gets us addicted, and it tastes good, but man, it just wreaks havoc on your oral health and your overall physical health.
Yeah.
But you mentioned a couple of things there. That can you elaborate more on the laser and the ozone, and how you use that, and what types of procedures that's helpful for patients? Because I'm not sure in the U.S. ozone is quite as common.
Ozone, we use it in different forms. We use it in the gas form. For example, I use it after I clean a cavity. I use it to kind of fully disinfect and start the healing process, especially if it's a really deep cavity that I feel that the pulp is closed. I use it, for example, in liquid form to irrigate, for example, perio pockets, or after cleaning, I irrigate with ozonated water, and we also use it in coconut oil, ozonated coconut oil. I use it for gums. I use it for aftas, for even for patients that are working in remineralizing cavities or reducing risk of cavities. We use it with the floss as well. Sometimes they dip the floss in the coconut oil, ozonated coconut oil, and then use it in the areas where they have lesions. So that is basically, ozone is a really powerful disinfectant, and it's a healthy, clean disinfectant with no chemicals. So I use it in any possible moment that you will need to disinfect. And then our hygienist, for example, uses it in the clinics, after clinics, to disinfect the mouth. And then she uses dental probiotics to kind of replenish with the good bacteria. So to kickstart our patients with good oral health after every cleaning.
Oh, that's great. Thank you for sharing that. It sounds like a wonderful protocol. Also, with your patient population, do you guys treat pregnant patients, and do you have tips for expecting mothers and how their oral health or just condition may be different during the 9 months of pregnancy?
Yeah, of course, I treat pregnant women, and I also work with women that are wanting to get pregnant, and they are maybe having difficulties with their fertility, with their hormones, together with my functional medicine colleague. And I really like to bring to the attention of my patients, especially the ones that want to get pregnant soon, is that they need to check their teeth before. Number one, because things are probably going to get worse during pregnancy. I mean, the baby's going to suck all out of you. So if you don't have enough nutrients, they're going to come from somewhere. So it's important to make sure that your health is in point before getting pregnant. Usually during pregnancy, the hormones tend to make gum disease worse. And it's important to always have your checkups during and your clinics during pregnancy. But also it is important because there's certain bacteria that you can have in your mouth that can travel and cross the placenta and go into the amniotic fluid. If there's a big infection in the mouth, potentially can cause harm to your baby and can cause difficulties during pregnancy and complications during pregnancy. So that's why it's really important to keep a close eye on your dental health before getting pregnant, but especially once you're pregnant. And also because our baby's teeth form in utero. So we need to make sure that our nutrients and the way we're eating, the way, I know, even the treatments we're having, we're careful with that, because everything is going to go to our baby. And of course, I hate to have to give antibiotics to a pregnant woman when they, sometimes you need to, but I mean, we all know that especially the last trimester of pregnancy, the microbiome of the mom is going to pass through the baby. So if we destroy that microbiome with antibiotics, we know that we are reducing the good bacteria that we're giving to that baby. So it's important to try and avoid this by having a healthy mouth before getting pregnant.
You bring up a lot of good points there. I think that's so important to consider the microbiome. I think in the past, with the philosophy of just scorched earth, kill everything, bacteria bad, we as physicians and dentists were inadvertently destroying our microbiome by giving out too many antibiotics. And yes, when your life is in danger, you need antibiotics, but I think they were probably given out way too routinely, and also looking at mouth rinses that have alcohol in them. The alcohol is so disruptive to the oral microbiome, and really just upsetting the balance of what nature had intended. So it's really good that you mentioned that point, because I think it's something that the medical community is kind of shifting their philosophy on just kind of respecting the microbiome and really trying to preserve the balance and equilibrium of the bacteria in your mouth and body.
Yeah, 100%. I've always been, not always, I mean, the last few years of my life, I hate mouthwash until I saw your mouthwash.
All right.
My husband loves his mouthwash. He was always using this alcohol full mouthwash. I was like, no, stop it, stop it. And he's like using it on the side. Until I found your mouthwash. I was like, you can only use this one, okay? Because
All
at
right.
least, it doesn't have any harmful things. It's not going to kill your good bacteria. And even it balances your pH, so it's going to help the natural process of the remineralization of the mouth. So I think it's really important. I still get a lot of patients asking me, which mouthwash should I use? Should I use always a mouthwash? And I think it's something that we've been instilled when we were younger, that I always remember having my mouthwash when I was a child, fluoride mouthwash, strawberry flavor. But nowadays, we need to be really careful with this type of, most of the mouthwashes in the market are really harmful for us. They are really acidic. They are doing the completely opposite of what we're looking in the mouthwash. They are basically killing our good bacteria, making the environment of our mouth more acidic. So I'm really happy for people like you to bring good quality mouthwash in the market for those that really need that mouthwash.
Well, thank you. You make a lot of good points. And one of the things that my sister Corey and brother-in-law John were discussing when we were kind of coming up with the RiseWell was looking at something that would be favorable for the mouth, taking alcohol out, using xylitol, which is a sweetener that's bacteriostatic, that is the bacteria cannot use to create the acid that cause decay, and have it with sodium bicarbonate, slightly elevated pH, to kind of create an environment where the decay causing demineralization process cannot occur, and have an amazing taste. So those are all things that we try to accomplish, and I'm glad it's resonating for you and your family. One thing too that you mentioned about pregnancy was, and again, I don't treat children, but we do have pregnant mothers in the practice, is pregnancy gingivitis. I think a lot of expecting mothers are kind of a little shocked and confused when they see that, wow, doc, my gums are bleeding more than usual and my teeth feel a little loose. And I really try and reassure them that, look, you're going through tremendous changes with your body right now, and you're not doing anything wrong. It's common to experience pregnancy gingivitis when you're expecting. So that just means that the gums bleed a little bit easier, but it is reversible. I just encourage them to keep up with their normal cleanings, be super diligent with their oral hygiene, and the teeth being loose, that is also reversible as well. But those are some common things that I try and just reassure patients, when I see them in that condition.
Yeah, I think also during pregnancy, and it happened to me as well, and I'm a dentist. You kind of, especially in the last few months, kind of your schedule changes. You don't sleep that well. You wake up, you eat at different timings, and sometimes you can neglect a little bit, the oral hygiene at the same time, together with the hormones and everything together. That's why I always recommend pregnant patients to visit us every trimester, so once every 3 months, instead of, usually we recommend once every 6 months. For pregnant women, we always recommend every 3 months to have a good cleaning, and then reassure that everything is going how it should, and it works like that.
Oh, that's good advice. And I'm curious, how do you get your own kids excited and just the children in your practice excited about oral hygiene? What tips and tricks do you have to get children pumped up and jazzed about keeping their teeth clean?
Look, I have my worst patient is my daughter. So she keeps me on my toes with coming up with ideas of how to get them excited. The last thing that worked for her is to get her an electric toothbrush. Things that work is doing like, she brushes me, I brush her, we all brush together as a family, we sing a song, and things like that. But let's be honest, most kids hate brushing their teeth. So sometimes we need to keep trying, coming up with different things, but sometimes we will need to force them, and I sometimes need to force my child to brush her teeth, and it's we need just a few seconds, but getting them excited, I think, especially for older kids, I would say from 2 up, you can start with little charts, with stickers, getting them like, there's some video games that you can play and they can brush at the same time. There's things like that. I would say for my daughter, for example, what it works is to do the songs and to do the sticker charts. And then at the end of the week, she will get, I don't know, watch a movie together or things like that. That she's a big fan of TV and she doesn't get TV during the week. So usually TV is the the prize for her.
Oh, that's great. So I use music to help me to remember to brush. That helps me.
Yeah, exactly. Music makes everything better.
That's right. Absolutely. So tell me, when someone or when children are having problems, or if they're out of balance, or if their oral health is really not where it should be, what warning signs can parents be on the lookout for if their child is really not doing well with oral hygiene and experiencing just kind of neglect or some deleterious effects in their oral cavity? Any advice for that?
Yeah, so like red flags would be, for example, a child that wakes up in the morning with bad breath. This should not happen. If they are breathing through their nose, if there's no cavities, no gum issues, normally a child doesn't have a bad breath. I mean, normal. So a child that wakes up with bad breath, gums that bleed, of course, that's a big red flag for kids. Kids that, for example, grind their teeth at night, this is another red flag that can tell us that maybe they are not breathing well. This is sometimes related to sleep apnea or snoring. Those are the main ones that I like to bring attention to the parents. These are things that you can see easily. And then, of course, if you see like brown or yellow areas in your kids' teeth, that's another big important one. I think the best way to make sure that your teeth and the oral health of your kids is okay is that by bringing your kids regularly to the dentist, because that way you also avoid drama. Because when you go to the dentist, when the kid is in pain, when the kid needs treatment, things are a bit more stressful for everyone. You need to treat the child. If they come, they don't need treatment. They just have a little bit of fun playing with the toys, playing with the instruments in the room. It's a little checkup, maybe a clean, and then they go home. They get their stickers, and that's it. That's much better, and I think is definitely a way of also helping parents to understand and give them tips and help them understand what things are important to do, what habits we can change, what things we can incorporate. So that's what I usually recommend.
I love that. That's great. Even in my practice, my adult patients, they like stickers, so everyone can be bribed.
Who doesn't, right?
So tell me, when do you make a referral when something is maybe outside your scope? Do you have a team of like airway physicians to make a referral to if something is outside your scope, or if you need intervention kind of beyond your practice? Do you have airway people on your team to help out with advanced issues in that regards?
Yes. I work with ENTs. I work with pulmonologists as well, depending on the case. Basically, what we do is in a patient that we suspect that they have any airway issues, sleep apnea, we do a sleep test. And then based on that sleep test, we will decide, is it a patient that can be helped just by, fixing some things in the mouth, my functional therapy, things like that, or is a patient that really has severe sleep apnea, needs to see this pulmonologist or this ENT, and maybe he needs to be put on a CPAP straight away, while maybe we try and fix the other things. But sometimes the sleep apnea is so severe that they need to be put on treatment straight away, and then we can try and win them off the CPAP by doing different things, or even reducing the pressure of the CPAP. And sometimes even we can do some oral appliances instead of the CPAP for patients that don't tolerate it well. But definitely I always work with ENTs, and I actually refer all my patients that I suspect airway issues to an ENT, just to have an assessment to make sure that they don't have like a deviated septum or huge turbinates or big adenoids, things like that. I always work in that sense, and I work with sleep medicine center for that.
No, that's really good treatment, and really great that your patients have access to that kind of information and specialty team. So also looking at procedures for adults, I really like hearing people's feedback on when you have cosmetic procedures. In the U.S., veneers are so popular, but I almost find myself talking, especially young people, I end up talking them out of veneers versus into them. And I'm a prosthodontist, and I love doing them. It's a great procedure when you have the right candidate. But what's your philosophy on composites, veneers, bleaching, ortho for young people looking to improve their aesthetics, and how do you kind of have those conversations with young people?
So I always, especially in young people, try to get them into more the path of doing some ortho, some whitening, and maybe some composite on the edges, just to kind of perfect what nature gave them. Also because if you put the teeth in the right place, you're also going to benefit more the breathing, you're going to help, with hygiene, everything is going to be better. It really makes me want to cry when I see, a 20-year-old with a full mouth of veneers, because most of the time you can do things to avoid this, more conservative things. They will have time to do them when they're older. They're going to need to replace these veneers in 20 years time if they're lucky. So that's what my approach is, to try and do the most conservative approach. Of course, veneers are a great option for patients that have teeth that are too small, teeth that have gaps and you don't want to close the spaces, teeth that have restorations, they don't have a good color or good surface, things like that, where you need to hide these teeth. That's a great option. And nowadays we have options of doing veneers with very minimal preparation, but in like nice virgin teeth that only need maybe a little bit of alignment and maybe a touch of whitening and a few spots of composite, I think that's the way to go 100%.
Yeah, and I love hearing that conservative approach. And I know there are two big famous veneer doctors out there in Dubai, but again, honestly, if it were my daughter, I would definitely push the ortho and bleaching for first-line therapy. And look, I love doing veneers. It's a great restoration, but not everyone's a candidate. And for people listening, just really be careful and get multiple opinions, because wonderful restoration, but just like getting a car, nothing in your mouth is probably gonna last forever. So you're really committing yourself to potentially doing that procedure maybe once, twice, 3 times. If you're in your 20s, that restoration's got to take you into your 80s and 90s. I mean, people are living so much longer, and just really be aware of what you're committing yourself to. It's an irreversible procedure,
and it's not
cheap. it's a big investment, and you need to realize that you might be committing or buying that investment 2 or 3 more times to take you to the end of your life. So just a lot to consider.
It's great to hear that from a prosthodontist, because obviously is what you do restorations in the mouth. So it's really great to hear that from you, because I wish everyone thought like you.
Well, thank you. I've just been in situations, and I know how I would want to be treated. I actually broke my front tooth as a kid, and I fell on a patch of ice. And luckily, I had a dentist that just did a composite and was able to tide me over. And I've had to have it replaced a couple of times, and it might turn into a veneer or crown at some point. But I'm still holding on to the composites. And I just this week I had a patient that came in for a second opinion, and he claims he has a small chip, and a previous dentist did some aggressive veneers on him, and now he's kind of concerned and a little worried that he didn't ask more questions before the dentist recommended a treatment. And look, I believe all dentists do their best, but sometimes there are different motivating factors about why providers choose certain treatments. And if it were your daughter in the chair, like, what would you really choose for that person? So that's a point that really hits home.
It's a treatment that brings a lot of money to a clinic. Sure. That's 100%. I mean, it's probably the most profitable treatment that I can do in the clinic, and it's probably the one that I do the least, because it's always the last of my resources if I can. Of course, if we're talking about a patient that has lots of other restorations or dark teeth or stained or things like that, this is a different conversation. But I'm talking about this beautiful, healthy, young teeth that we don't want to touch.
Absolutely, yeah. Respect the enamel. So no, it's good to hear that. I'm curious, any other differences between life and practicing in Dubai versus Europe, where you're from, and any other interesting differences when you first moved out there?
Ooh, for me, it was day and night. I came from a really busy clinic in Ireland. I was working too many hours, and I was definitely not having enough time to see my patients. I had consultations every 10 minutes,
Wow.
double bookings, one on top of the other. So I had to kind of see them really quickly, do the treatment, out the door. The owner was not a dentist. He was very into business, and he was like, we cannot say no to anyone. The prices were quite low, so we had a lot of patients coming.
Yeah.
And it was quite stressful for me. I mean, I'm really grateful because I got to do so many treatments for so many patients, but sometimes you wish you had more time for them. And now I moved to a completely different clinic, which is focuses a lot on the patient journey, the quality of the service, and I have 1 hour for my consultation, first consultation with a patient. I have access to a CT scan, I have access to laser, I have access to ozone. It's like the dream for me, It's really good because I have really great team within the clinic of specialists of all specialties actually, and we are all very close and always sharing the treatments and ideas because we can always learn from each other. So it's a completely different way of working. I'm really happy that I made the switch, and especially because the owner is really has the same approach to dentistry like I do. He's super biological, and it's really good.
No, that's wonderful to hear, and very happy for your opportunity out there, and your patients are lucky to have you. Tell me, what projects do you have coming up this year? Any fun announcements or any things you're working on, or fun things to look forward to for you and your team out there?
So I'm actually planning to, I'm trying to bring to life some online courses for my patients, especially the patients that I have from Ireland. I have a lot of followers on my Instagram from Ireland that they don't have access there to functional dentistry, airway dentistry. So I'm trying to put together some courses and videos and some information, educational information for them to have. Hopefully, I don't know when I have time, but that's a goal for this year for sure. And then, of course, always keep learning. I always say that I'm not going to do more courses, but I keep doing more and more courses. It never ends.
I hear you. I'm a dental CE junkie as well, and just fills up the calendar. But I feel like those investment dollars, you get them back, and just learning knowledge and education, just investing in yourself.
Exactly.
Well, that's great to hear. And I want to invite our listeners to ask Dr. Laura any questions they may have. There are some that my team compiled here, so I'll just kind of dive in and read them here. And first question: what would you suggest for an open mouth breather where a myo brace didn't work? Any thoughts on that?
My brace that didn't work, sometimes we need to look into how was it followed up. So did they do my functional therapy as well? So basically, when you have mouth breathing, you need to look first, making sure that you can breathe through your nose, because sometimes it doesn't matter what you do in the mouth. If you have a blockage in the nose, nothing is going to work. So visit an ENT. Make sure that you can breathe through your nose. Then check if you have a tongue tie. You need to check with a myofunctional therapist most of the time. You need to make your tongue and lips relearn how they should move and where they should be. So those are the key points.
And I'm not familiar with MyoBrace. Is that a specific company or brand name or
It's like,
style, or what does that mean?
yeah, it's like a brand of an appliance. It's like an orthodontic
Okay.
appliance. It aims to correct the position of the teeth, but it's supposed to work together with a myofunctional program. But I know not every dentist that does MyoBrace does actually the myofunctional protocol. So it's probably the most important. It's basically an appliance that it's like a silicone appliance that you put in the mouth and you sleep with it, and then you use it a couple of hours a day. But the myofunctional program is the most important, because if you're not retraining those muscles, the orthodontic treatment is not going to work, or is going to relapse.
Got it. Okay. Thank you for that. Next question. How do you fix mouth breathing problems? I think you covered a lot and elaborated a lot on those conditions there. Next question is, can you suggest any vitamins for maintenance of our teeth and oral microbiome?
In general, I don't like to give vitamins without doing testing. And I will tell you, because myself, I almost overdosed on vitamin D.
Oh.
No, not overdose, but I was taking vitamin D for a while, because, vitamin D
Sure.
is one of the important ones for the teeth.
Yeah.
And the last time I checked was a couple of weeks ago, and I have 94, which is like very, very, very high. So obviously I stopped taking the vitamin D, but I always check every 6 months my levels of vitamins in general. So before starting any vitamins or supplements, check your levels, because maybe you don't need them. But vitamins that are good for the health of the teeth is vitamin D, K2, magnesium, minerals in general. Any trace minerals are really important, of course, for the teeth. And then omega-3s for the gums are also really good. Ideally, I recommend to try and get them from the food and from sun exposure, eating more beef, more proteins, more salmon, fats, grass-fed fats are really, really good. But sometimes we need some help from supplements, but always check before.
No, that's good advice. And lastly, is teeth clenching a reason to visit ENT?
Clenching, not so much, but grinding, sometimes yes. I think it's important to visit first a dentist that is trained in airway, but a lot of the times teeth grinding at night is related to sleep apnea or difficulties breathing through the nose. Basically what happens is, if you're breathing through your mouth, your body is trying to bring the jaw forward to open the airway and let you breathe better. So it kind of happens like that. I have a lot of parents that record their kids to show me, and they have these apnea episodes where they're like, and then straight away grind. Okay, so it happens a lot of the times. You have apnea followed by grinding. It's your body trying to accommodate the airway. So you need to see an ENT every time? Not really. Check with the dentist, ideally trained in airway, and they will probably refer you to an ENT if they suspect any problems.
Hey, Dr. Laura, thank you so much. I want to encourage all of our friends over in Dubai and the UAE to go visit Supplement Hub, where you can get 10% off 2 or more RiseWell products to stock up on your favorite goodies and really prevent demineralization and encourage remineralization. So Dr. Laura, again, thank you for your time today, and we wish you nothing but success and happiness this year.
Thank you so much for having me, and I wish you very good success with your products.
Thank you so much. Take care now.
Thank you. Bye-bye, everyone.